The Indian Council of Medical Research issues guidelines for all individuals who have undertaken international travel in the last 14 days but still not showing symptoms of coronavirus. Says should stay at home under quarantine for 14 days. Also says they should be tested only if they show symptoms. Amidst the coronavirus scare, UP Chief Minister Yogi Adityanath says 1,000 rupees will be given to daily wage labourers and construction workers to help them meet their daily needs. All metro, rail, state and city bus services in the state will remain closed tomorrow. Says we all must adhere to Janata Curfew called by Prime Minister Modi. The PM holds a meeting with the Chief Ministers of states through video conferencing, calls on states and the centre to work together. Meanwhile, the number of confirmed COVID-19 cases has risen to 258. In a major announcement to fight coronavirus, no passenger train will originate from any railway station in the country from tonight midnight till 10 p.m. on Sunday. Mail and express trains will also stop services from 4 in the morning on Sunday. Prime Minister Modi thanks people from different walks of life for supporting the cause of Sunday's Janata Curfew. Influencers and achievers from various fields and several organizations have come out in support of the Janata Curfew. States take major steps to prevent coronavirus spread. Ban on outside passengers in Leh, Mumbai, Nagpur, Pune and Pimpri Chinchwad to remain closed in Maharashtra till the 31st of March. Exemption for essential services, banks, grocery stores and medical stores. All malls closed in Delhi till the 31st of March. All markets in Delhi to be closed for the next 3 days. No metro services on Sunday. Section 144 imposed in Haryana. Coronavirus continues to spread across the world. More than 2.5 lakh infection cases and death toll has crossed the 10,000 mark. Italy records 627 deaths, taking the toll over 4,000 on Friday. France reports 78 more deaths within 24 hours. UN chief warns that global recession is a near certainty. Namaskar, you're the latest here on DD News and DD India. I'm Gautam Roy. Now, the Indian Council of Medical Research has issued a revised strategy of COVID-19 testing in India. The ICMR, in its revised treatment strategy, has said that all asymptomatic individuals who have undertaken international travel in the last 14 days should stay in home quarantine for the 14 days. They should be tested only if they become symptomatic, that is, if they have fever, cough, difficulty in breathing. All family members living with a confirmed case should be home quarantined. The ICMR has also issued testing strategy for all symptomatic contacts of laboratory confirmed cases, all symptomatic healthcare workers, all hospitalized patients with severe acute respiratory illness, asymptomatic direct and high risk contacts of high risk case should be tested once between day 5 and day 14 of coming in contact with the symptomatic person. Direct and high risk contact include those who live in the same household with a confirmed case and healthcare workers who examined a confirmed case without adequate protection according to WHO recommendations. Now, a total of 23 people have been found to be infected with coronavirus in Uttar Pradesh so far. The state's Chief Minister Yogi Adityanath in a press conference in Lucknow said that out of the total cases, 9 people have recovered and there is a sufficient number of isolation wards in the state.
अब तक कोरोना वायरस से 23 पेशेंट चिन्हित हुए थे। इनमें से 9 पूरी तरह स्वस्थ हो चुके हैं। स्वाभाविक रूप से इससे घबराने की नहीं बल्कि इन चुनौतियों से जूझने और लड़ने के लिए अपने आप को तैयार करने की आवश्यकता है और इसमें बचाव का पक्ष सबसे बड़ा महत्वपूर्ण है।
The UP CM also said that 1,000 rupees each will be given to 15 lakh daily wage labourers and 20.37 lakh construction workers to help them meet their daily needs.
श्रम विभाग के द्वारा 20,37,000 जो निर्माण श्रमिक पंजीकृत हैं, इन सभी श्रमिकों को हम लोगों ने तय किया है कि तात्कालिक रूप से भरण पोषण भत्ता के रूप में 1,000 रुपये डीबीटी के माध्यम से हम इनके अकाउंट में देने की सहमति प्रदेश सरकार ने दी है। ठेला, खोमचा, रेहड़ी, रिक्शा चलाने वाले जितने भी अन्य इस प्रकार के छोटे छोटे कारोबार में लगे हुए दिन प्रतिदिन कमाने वाले लोग हैं, 1,000 रुपये की राशि भरण पोषण की दृष्टि से तत्काल रूप से सरकार इनके लिए भी अपना स्वीकृत कर रही है।
And the UPCM also announced that 1 month free food grain will be provided to the poor ration card holders.
ग्रामीण क्षेत्र हो या शहरी क्षेत्र हो, इन सभी में जो भी कार्य करने वाले लोग हैं, खासतौर पर जो मजदूर हैं या ठेला लगाने वाले हैं, खोमचा लगाने वाले हैं, यद्यपि सरकार ने एक अभियान चलाया था, इन सब के लिए राशन कार्ड प्राथमिकता के आधार पर बनाने की कार्रवाई अगर नहीं है, तत्काल बंद करके उन्हें खाद्यान्न उपलब्ध करवाने की कार्रवाई को हम लोगों ने आगे बढ़ाने की दिशा में एक नया प्रयास प्रारंभ करने के लिए कहा है कि उन्हें तत्काल खाद्यान्न उपलब्ध हो जाए।
Steps to tackle the COVID-19 challenge are being taken on war footing. Prime Minister Modi held a video conference with chief ministers of various states and deliberated upon ways to check the spread of the virus. Union Health Minister Dr. Harshvardhan and top health ministry officials were also part of the meeting, which was held via video link. The PM said that the threat of the pandemic is common for all states and underscored the need of the centre and all states to work together. He said that while participation of citizens is necessary to combat the challenge, but panic needs to be avoided. He added that given the global context of the spread of the virus in various countries, constant vigil is of paramount importance. He said that the next 3 to 4 weeks are crucial in efforts to contain the spread of the virus, and the most important measure of containment is social distancing. He requested the chief ministers to ensure effective implementation of social distancing. The chief ministers briefed the Prime Minister and others about the preparations done till now. They requested for augmentation of testing facilities, greater support to vulnerable sections, advancement of financial disbursement for 2020-21 to the states, and requested for roping in private labs and hospitals in large numbers. All the chief ministers assured their support and reaffirmed that all states will work together with the Government of India to combat the pandemic. They thanked the Prime Minister for the support given by the centre and also appreciated the impact of Prime Minister's message in his address to the nation. The PM in turn appreciated the steps taken by the states and thanked them for sharing their experiences and giving suggestions. Now, the total number of coronavirus cases in the country have gone up to 258. Active cases across the country are now 231. 22 people have recovered from after treatment. 1 has migrated, while 4 deaths have been recorded in the country. Now, in a major announcement, Indian Railways has said that no passenger train will originate from any railway station in the country from midnight tonight till 10 p.m. on Sunday. Mail and express trains will also stop services from 4 in the morning on Sunday. All suburban train services will be reduced to a bare minimum as well. Passenger train services already on the run will be allowed to run to their destinations. Now, the IRCTC has also ordered the closure of all on-board catering services in mail or express trains from the 22nd of March until further notice in view of the coronavirus outbreak. IRCTC has also decided to close all food plazas, refreshment rooms, janahars and cell kitchens until further notice. The static units supplying meals to prepaid trains which are in operation may continue to operate. The onboard catering services in Mail Express trains and TSV trains should be closed until further notice as well. Prime Minister Modi has hailed the efforts of people from various walks of life who have come together to support the initiative of Janata Curfew tomorrow, which is the 22nd of March, in an effort to contain the spread of the coronavirus. Influencers and achievers from various fields and several organizations have come out in support of the Janata Curfew and have urged the nation to come together to make it effective. Various steps are being taken by state governments to prevent coronavirus spread. Ladakh administration has ordered all commercial flights not to carry outsiders to Leh airport. Secretary and Divisional Commissioner Saugat Biswas said the administration is taking stringent precautionary and preventive measures in view of outbreak of COVID-19. In an order, inbound passengers other than residents of Ladakh, civilian officers and officers of uniformed forces serving in Ladakh or on duty in the region shall not be carried by the commercial flights to KBR airport in Leh. Now, amid growing concern over the spread of coronavirus, Maharashtra Chief Minister Uddhav Thackeray has announced that all workplaces in major cities in Maharashtra, including Mumbai and Pune, will remain closed till the 31st of March. The shutdown will be applicable in Mumbai Metropolitan Region, Pune, Pimpri Chinchwad and Nagpur. Essential services will remain open, which include food, milk and medicines. Banks will also remain functional. In the national capital, the state government has decided to discontinue its non-essential services till the 31st of March and allowed workers of such departments to work from home. All shops and shopping malls will be closed till the 31st of March except shops dealing with items of daily needs. The Delhi Metro Rail Corporation has decided to suspend its operations on the 22nd of March, which is tomorrow, in support of the Janata Curfew. Most cabs and all auto rickshaws too will remain off the roads. Meanwhile, the Haryana government has asked all deputy magistrates and commissioners of police of the state to invoke Section 144 of the CRPC as a precautionary measure to prevent the spread of COVID-19. 6 fresh cases of the new coronavirus have surfaced in Rajasthan. Among the 6, 5 are staff members of a private hospital in Bhilwara, where a doctor tested positive for COVID-19. Another positive case is from Jaipur. The total number of positive cases in the state has climbed to 23. Out of these 23, 3 patients, including an Italian tourist couple, have recovered. The district administration of Bhilwara has sealed the borders of the city and implemented prohibitory orders under CRPC Section 144 to prevent the spread of the virus. Similar action was taken in Jhunjhunu, where 3 positive cases were detected. When everyone prefers home isolation to stay safe from coronavirus, these brave Safai Karmacharis of Jaipur Municipal Corporation are braving every day to maintain sanitation and cleanliness. Let's join our hands to applaud them along with the medical and health workers on the appeal of Prime Minister Modi tomorrow. Meghalaya government has decided to impose restriction on movement of public transport and to close all shops, markets and establishments with effect from midnight tonight to midnight of the 21st of March 2020 throughout the state. The restrictions have come in view to enforce the advisories and restrictions issued by the state government for containment of COVID-19. Arunachal Pradesh government has barred all visitors from entering the state. In an order issued on Friday, the government said that all visitors and tourist inner line permits stand cancelled with immediate effect. The Uttarakhand government has also banned the entry of domestic and foreign tourists into the state till further orders to contain the spread of the coronavirus. In Kerala, 12 more persons have been confirmed with COVID-19. With 12 fresh cases reported, the total number of confirmed COVID-19 cases in the state has reached 37. Addressing the media, Kerala Chief Minister Pinarayi Vijayan said that among the new cases, 5 were foreigners, 6 are natives of Kasaragod district. He said the Kerala government will support Janata Curfew on Sunday in all possible ways. Meanwhile, severe restrictions have been imposed in Kasaragod district. Time for a quick break now. Get you more updates in just a bit. Stay tuned.
सवा करोड़ से ज्यादा आबादी का देश, तो लगभग इतनी ही जेबें भी होंगी, पर एक वीआईपी नंबर है जो लगभग हर एक जेब में पाया जाता है। उसे दिखाओ तो बैंक में खाते खुल जाते हैं आसानी से। अपने हक के पैसे सीधे खातों में आ जाते हैं आसानी से। बैंक हमारे दरवाजे तक पहुंच जाता है। इनकम टैक्स वेरिफिकेशन भी हो जाता है आसानी से। इसीलिए कहते हैं भैया,
आधार अपना लो,
फायदे में रहोगे।
ओ पोषण पर दे पूरा ध्यान, पिता की ये सच्ची पहचान।
ये कौन सा गाना गा रहे हो किशन?
महाराज अब चलिए तो सब समझ में आ जाएगा।
अरे कहाँ गए थे किशन? बेटी का अन्नप्राशन है, बाप बन गए हो, कोई जिम्मेदारी है कि नहीं?
बाप वाली जिम्मेदारी निभाने ही गए थे बाबूजी। ये देखिए, मुन्नी के लिए पौष्टिक आहार लाए हैं और साथ में महाराज जी भी। सबके लिए अच्छा खाना बनना चाहिए भाई। पिता की यही
सच्ची पहचान।
हाँ।
देश उम्मीद से है, करो पोषण।
पिता हो तो किशन जैसा, जिन्हें पता है कि बच्चे के 6 महीने के होने के बाद उसे घर का बना पोषक आहार देना और साथ ही स्तनपान जारी रखना बहुत जरूरी है।
संतुलित और पोषक भोजन जरूरी है, विशेष रूप से महिलाओं और नवजात शिशुओं के लिए। यही हमारे समाज के भविष्य की नींव है।
पोषण के 5 आधार: स्वच्छ हो घर संसार, आहार हो खूब अच्छा, रहे 10 से दूर बच्चा, खून में कमी ना हो, 1000 दिन पोषण दो, पिता होने की सच्ची पहचान, पालन के साथ पोषण का भी ध्यान।
नमस्कार, मैं एनएसओ से सर्वे के लिए आया हूँ।
आइए।
मधु, क्या तुम्हें एनएसओ के बारे में पता है?
हाँ बिल्कुल, एनएसओ का काम घर घर जाकर स्वास्थ्य, शिक्षा, घरेलू खर्चे, कृषि, रोजगार, बेरोजगारी जैसे सामाजिक आर्थिक विषयों पर सर्वे करना है।
हाँ, और मैं बताना चाहूँगा कि सर्वे को लेकर आपकी पहचान गोपनीय रखी जाती है। एनएसओ सर्वे भारत सरकार की विकास और कल्याण की नीतियाँ और योजनाएं बनाने में प्रयोग होते हैं।
गुड, और इसलिए हम आपके हर सवाल का जवाब बिना किसी झिझक के सही देंगे।
करें विकास में भागीदारी, एनएसओ को दें सही जानकारी। नेशनल स्टैटिस्टिकल ऑफिस, भारत सरकार।
Welcome back. Now, Air India will send an aircraft to Rome this afternoon to evacuate Indians stranded there amid the coronavirus crisis. The flight to Rome would take off from the Delhi airport around 2:30 in the afternoon. The flight will evacuate all Indians stranded in Rome and return to Delhi on Sunday morning. Now, with coronavirus outbreak reaching another stage, leaders have been concerned about the situation. With WHO acting as the backbone of the virus-hit countries, its India representative Dr. Hendrik Beckedem told in an exclusive conversation with DD India that PM's attitude towards handling coronavirus has been very powerful. He also said that India took the situation very seriously at the very outset.
I think first of all, I think Prime Minister really touched people, and I think the whole Indian nation was with him, and also very important that he asked solidarity. He asked people to stay in touch with each other, inform each other, be together, because I think if you want to fight diseases, you need to do it with the community, and I think that he put very clearly to the fore. I think India had also the advantage, they took it from the onset very seriously.
In addition, UNICEF's representative to India, Dr. Yasmin Ali Haq, hailed Prime Minister Modi's COVID outreach. Dr. Haq also said that she bears full respect for those in front line of war against COVID-19 and applauded it by saying that India is doing everything possible to contain the virus.
Final thing that really stood out for me was the respect. The respect for those in the front line, for the cleaners who are doing work that others might not want to do, for our frontline workers, especially the nurses, the hospital workers, the doctors who are selflessly taking a risk. They are exposing themselves because that's their duty and obligation that they have signed up to. And for us to respect them for that and to support them in it is extremely important.
Now, a series of myths related to COVID-19 have been busted. The first one relates to should one avoid eating meat, poultry, fish and eggs to prevent COVID-19. The answer to this is clear, it's a no. However, it's always a good idea to eat thoroughly cooked non-veg food. The second myth buster relates to can pets at home spread COVID-19. The answer again is a clear no. There is no evidence that pets such as dogs or cats can transmit COVID-19. However, it is always a good idea to wash your hands with soap and water after handling pets. The third mythbuster relates to are hand sanitizers the only solution to protect oneself from COVID-19? The answer is again no. Practicing frequent hand washing with soap and water is enough to stay protected from COVID-19. However, if you don't have the facilities of soap and water, use alcohol-based hand sanitizer. And now let's get you some facts about coronavirus as well. Well, what are coronaviruses? Well, coronaviruses are a large family of viruses. They cause diseases ranging from cold to SARS. Coronaviruses are physically larger than other viruses. They have spiked projections which resemble a crown, hence the name corona. There are 7 strains of human coronaviruses. 6 strains of coronaviruses were known earlier, including SARS and MERS. The 7th strain of the coronavirus is named as COVID-19. Coronaviruses cause respiratory infections in humans. Coronaviruses are known to cause a significant percentage of all common colds in humans. They also spread through both direct and indirect contact. Now coming to the history of coronavirus outbreaks, there's SARS as well, which was there, and 2003 the SARS infection quickly spread from China to other Asian countries. 8,098 reported cases of SARS and 774 deaths took place. Smaller number of cases in several other countries as well, including 4 in the UK plus a significant outbreak in Toronto in Canada. People over the age of 65 are particularly at risk. How SARS was brought under control, if that is the question that you're asking, well, policy of isolating people suspected patients really, screening all passengers traveling by air from affected countries is also very, very effective. Let's also tell you about another coronavirus outbreak of MERS. Well, Middle East Respiratory Syndrome coronavirus, first identified in Saudi Arabia in 2012. Since 2012, 27 countries have reported cases of MERS. Approximately 35% of reported patients with MERS co-infection have died. Most of human cases are attributed to human infections. The primary host is intermediate host camels. No vaccine or specific treatment is currently available. Now, United Nations Secretary General Antonio Guterres in a video message has called for solidarity, hope and political will to see this crisis through, which has been triggered by the COVID-19 outbreak. He talked of the need for global cooperation in the fight against COVID-19.
We are facing a global health crisis unlike any in the 75-year history of the United Nations. People are suffering, sick and scared. A global recession, perhaps of record dimensions, is a near certainty. This is a moment that demands coordinated, decisive and innovative policy action from the world's leading economies. We must recognize that the poorest countries and most vulnerable, especially women, will be the hardest hit. This is above all a human crisis that calls for solidarity. In managing it, we also have a unique opportunity. Done right, we can steer the recovery towards a more sustainable and inclusive path. I call on all leaders to come together and offer an urgent and coordinated response. And the United Nations will support all governments to ensure that the global economy and the people we serve emerge stronger from this crisis. More than ever before, we need solidarity, hope, and the political will to see this through together.
Now, hundreds of millions of people worldwide kicked off the weekend under the coronavirus lockdown as the global death toll accelerated sharply, and the World Health Organization warned young people they were not invincible. The virus death toll has surged past the 11,000 mark worldwide, with 4,000 in worst-hit Italy alone, where the daily number of fatalities has shot up relentlessly over the past week. WHO chief's remarks about reports that young people in many countries are being complacent about health warnings because of the greater susceptibility to the virus among older patients.
Today, I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else. I'm grateful that so many young people are spreading the word and not the virus. As I keep saying, solidarity is the key to defeating COVID-19. Solidarity between countries, but also between age groups.
And that's all we have in this edition of the news on DD News and DD India. For all the latest, stay tuned.